There are three main approaches in our healthcare system. The first, and probably the most familiar to you, is the standard, conventional, allopathic medical model. The medical approach is a symptom, diagnosis, treatment-based model. The patient describes a set of symptoms they are experiencing, and then based on these symptoms, the medical doctor comes up with his diagnosis. Now, based on this named diagnosis, which is nothing more than a label for the symptoms the patient is experiencing, the doctor then opens his book and prescribes a treatment that goes along with that particular diagnosis. Within the allopathic model, treatment is generally limited to two possibilities: drugs or surgery. Drug treatment is focused primarily on the suppression of symptoms, while surgery is often employed to remove a growth or diseased organ with the hopes that by removing that organ or growth, disease is then removed from the body. The allopathic model, then, is based upon the notion that a lack of good health is due to a deficiency or lack of drugs and surgery. It's not uncommon for patients taking one drug to experience a plethora of side effects, for which they are then prescribed more drugs to counteract those side effects. In our experience, patients receiving care within the standard allopathic medical model are generally on anywhere from 3 to 20 plus prescription medications at a time, or have had one or more surgeries only to find themselves in a state of rapidly deteriorating overall health. The patient then finds himself looking for answers elsewhere. So he gets on the internet, schedules an appointment with Dr. Google, and before long finds himself within the second model, complementary and alternative medicine. Like the standard allopathic model, the complementary and alternative approach is also a symptom, diagnosis, treatment-based model. The patient describes the symptoms he is experiencing, and based upon those symptoms, the alternative practitioner gives the patient his diagnosis. Based on this diagnosis, the alternative doctor then develops a treatment protocol. The alternative practitioner says, quote unquote, "Drugs are bad. You don't need drugs. What you need is a healthy dose of my herbs, vitamins, homeopathic remedies, special diets, and a few other so-called natural remedies along the way." These agents, though, like drugs, suppress the patient's symptoms. The alternative model is based upon the notion that a lack of good health is due to a lack or deficiency of vitamins, herbs, homeopathic agents, special diets, and other remedies of one type or another. It's not uncommon for patients to jump from one remedy, one diet, one herb, etc., to the next with the hopes that they will find just the right combination to cure what ails them. They enter what I like to call the black hole, in which they become trapped in a never-ending cycle of treatments that neither addresses the causes of their health problems nor gets them well for any significant length of time. What most patients fail to recognize is that the alternative approach and the medical approach are fundamentally the same. Patients are sick not because of a lack of drugs and surgery any more than they're sick because of a lack of vitamins, herbs, and other alternative remedies. Regardless of the agent, drug, herb, or otherwise, the end result is the same: symptom suppression with the perpetuation of sickness and disease. The medical and alternative approaches are focused on tinkering with symptoms rather than addressing the causes of a patient's health issues. To better illustrate this point, let's make use of a simple analogy. Picture yourself driving to work, minding your own business, and bam, on comes the check engine light. So you take your car to the mechanic. He takes a look inside at the dash and he says, "Oh, look, here, I see the problem. The check engine light's on. I can take care of that for you right away," he says. So he goes in his shop, comes back with his tools, and he proceeds to cover up the check engine light with a piece of metal. "There you go," he says. Now you say to yourself, "Wait a minute, that's not quite right." And he says, "What's the matter? Is that not what you wanted? Okay, let me try something else." So he grabs his tools, takes off the metal covering up the light, and then proceeds to remove the check engine light altogether. There, he says, problem solved. See, what the mechanic essentially did was cover up the symptom. Then he proceeded to remove it without ever popping the hood to see what was actually causing the problem. This is exactly what happens in the medical and alternative approach. What we need then is a more rational approach, one based on the identification of root underlying causes rather than treating symptoms. Let's pop the hood and figure out what's actually happening, rather than cover things up with drugs and alternative agents. Unlike the medical and alternative models, the Goldberg Clinic is based not upon the symptom diagnosis treatment system, but rather one based upon identifying and addressing causes. We are a full-scope practice that incorporates all aspects of health with a specific focus on identifying causes, addressing causes, and working to create the optimal conditions under which health can then be restored. Our approach incorporates clinical epidemiology, natural hygiene, clinical nutrition, and chiropractic and physiotherapy. Rather than treat patients based on their named disease or diagnosis, we instead work with people on an individualized basis, recognizing that patients are unique from a genetic, biochemical, and environmental standpoint. To treat each patient as if they were the same, i.e., based on their named condition as is done in conventional and alternative approaches, is a mistake.